Today in this lecture, we are going to discuss a few terminologies which will be repeatedly used in the coming lectures about the renal system. So the first term we will discuss is concentration, then osmolarity, then osmolality, and finally specific gravity. Concentration is simply the amount of a substance, the amount of solute, it is the amount of solute in a given volume of solvent. Now it is simple, the amount of solute, it may be in grams or in moles or anything. So it may be, for example, 1 gram of sodium chloride in 1 liter of water, or it may be 1 gram of glucose in 1 liter of water. So concentration is simply the measurement of the fixed, a specific amount of solute in a specific amount of solvent. This is concentration. Osmolarity, on the other hand, is the number of particles of solute per liter of a solvent, and osmolality is number of particles of solute per kg of a solvent. Now osmolarity and osmolality are more or less the same in but the only difference is osmolality is number of solute particles in the liter, while osmolality is the number of solute particles per kg of a solvent. So here we take liters and here we take in kilogram. Now number of solute particle is important to differentiate it from specific gravity and concentration, because for example, if we take here in case of sodium chloride, then the osmolarity and osmolality of this 1 gram sodium chloride in 1 liter of water or 1 kilogram of water will be more as compared to osmolarity and osmolality of 1 gram of glucose. So osmolarity and osmolality of 1 gram of sodium chloride will be higher than osmolarity and osmolality of 1 gram of glucose in same amount of solvent, because sodium chloride will dissociate into sodium and chloride. Sodium is one particle and chloride is another particle. So osmolarity and osmolality is about the number of particles. It is about the number of particles. More the number of particles and more will be the osmolarity, and more will be the osmolality, depends if we take it in liters or in kilograms. But concentration is just it is a rough estimate of the amount of solute in the specific amount of solvent. Now when we come to specific gravity, if we simply define it, it is the comparison of one density to another density, and most of the time it is comparison of density of a solvent, density of a solution to density of water. For example, density of urine as compared to density of water. Now if we compare it, the urine is around 1.002 gram per ml as compared to water. It is slightly heavier than water, so it is the comparison of two densities. But how we measure specific gravity? So specific gravity is dependent upon both the factors. It is dependent upon the number of solute particles as well as weight of the particles. It is dependent upon number as well as weight of the particles, and weight of these particles is determined by their volume and their mass. So if these are two solutions, there the solvent and there are solute particles. Now here the solute particles are small and here the solute particles are a little bit large, their weight is higher. So the number of solute particles is the same, but the weight of solute particles in this solution is higher, so the specific gravity in this case will be high. If we have a solution in which the particles are more in number as well as larger in volume and has more weight, then the specific gravity of this solution will be greater than this one because of the number. So here the specific gravity of this solution is greater than this one because the number of the particles are the same but their weight is greater. The weight of the particles in this solution is greater than the weight of the particles in this solution. But here the weight and the number of particles in this solution is greater than this one and as well as this solution. So specific gravity is dependent not only about the number of particles, but it is also about dependent upon the weight of particles in solution. Now most of the time when concentration of a substance increases, specific gravity also increases. Most of the time concentration increases, so specific gravity of a substance also increases. But sometimes in urine there are large particles. There are large particles. The volume of the particles is very high. The weight of those particles is very high. So those substances, they increase the specific gravity. They increase the specific gravity, but they do not increase the osmolarity. They do not increase the osmolarity. Most of the time, when osmolarity increases, the specific gravity increases. But sometimes, because of the weight of the solute particles, the specific gravity may increase. The specific gravity may increase, but the osmolarity may not increase, because osmolarity is dependent upon the number of particles. When we do not increase the number of particles, rather only increase the size of the particles, this may increase the specific gravity but may not increase the osmolarity. Now, these are the terminologies which we have discussed in detail, and in the coming chapters of renal system, we will be using these terminologies again and again to understand different concepts. Thanks a lot for watching the video.